So we have one more person, Cadence from Vermont, looking for better ways to communicate a long, complex chronic illness history to healthcare practitioners.
Yay.
So happy to have you here. Thanks
Yeah.
for joining.
Thanks for joining from Vermont. Okay, so Christina, is it Kantzavelos? Am I saying it correctly? Okay. Is a neurodivergent and first generation licensed clinical social worker, a life coach, a writer, and chronic illness warrior. She specializes in treating clients with chronic health conditions, also known as spoonies or medical refugees, and trauma, including medical trauma. So her experience as coming from her patient background and now a provider treating patients who are dealing with complex conditions like us is very special and unique. So I'm going to go ahead and share my screen and let's get Christina started with her slides. So, does this look okay?
Muted. That looks fantastic. Yes.
Okay, great.
Yes. Welcome to this event. So creating a timeline as a mind-body tool. So yes, you can go to the next slide. So as she mentioned, my name is Christina Kantzavelos. My practice is called Begin Within Today, and I am a chronic illness warrior advocate and treat those with complex illnesses. And, I won't get too much into my story other than to say, I suffered from complex health issues from a very young age, and it was all relatively manageable, meaning I was able to hold a job and, relationships and so forth until it came to a head in 2018. And I was, fainting on the job, which, you're not supposed to do, and things like that. I ended up finding out I had Lyme disease, co-infections, and all kinds of things, parasites and mold illness, SIRS, and mast cell activation syndrome. And I'd been already diagnosed with so many autoimmune diseases, but now I had even more that I was diagnosed with. And anyway, so I say that it took me getting really sick to get healthy and to really understand how fierce the mind-body connection is. And I also want to say that I had no intention of doing this as my profession, as my work. Like this journey is what brought me to this. Like previous to creating my practice, I was doing disaster relief work. So I was with Doctors Without Borders and other NGOs. I thought that was my path and that's what I was meant to do. And obviously I had to mourn that identity loss of what I thought was meant for me. And I stepped into this role realizing that I couldn't find a psychotherapist who specialized in chronic illness and was both trauma and somatic informed. And I basically had to create this for myself. I had to become the person I wish I had while I was really sick. So we're going to get into the mind-body connection. And honestly, this is in many ways what saved my life was understanding the mind-body connection and utilizing the tools and resources out there to heal myself and get myself to a point where I was able to be out in the world again, and not in a survival response, but more so in a thriving response where I'm radically accepting where I am and working with those limitations in a way that feels good to my body, to my mind, to my spirit. All right, go to the next one. Yep, so again, welcome. Everyone here deserves to be heard, seen, believed, and I'm excited to team up with Pictal to discuss this mind-body connection and this amazing tool. And as a holistic therapist, it's so important that we see you as a whole being. We're not just one thing that happened to us. We're not just our illness. We are mosaic pieces, and it's important whoever you work with as a practitioner, that they see you this way, that they look at your entire picture. So what I love about Pictal is that it helps you track your story and helps you connect dots within it. And And the other thing I want to say, and I posted this to Instagram, and this came up in a conversation with Katie, is that healing happens when we're able to tell our story in a safe and courageous space with someone. It puts us into this parasympathetic response. We're no longer having to hold it in. We're able to share it in a way where we are trusted and believed, and vice versa. So this is a tool that allows for that. So let's talk about physiological and psychological responses and what that has to do with our physical health and how they impact one another. So in my history of this work, of anyone who comes to me with any kind of complex illness or mysterious illness of any kind, without fail, are always in a chronic stress response. And that can look like 4 different things. So everyone knows fight or flight, right? But a lot of people don't realize there's 4 F's. So, people, when I first mentioned this to a lot of folks, they're like, wait, you don't see me running, you don't see me fighting. I don't understand. Well, I say freeze response is what we do when we cannot physically flee a situation. And often we get stuck in this dorsal response of dissociation, numbness, being stuck in a rut in our head, in our bodies. And then also fawning, which is a coping mechanism characterized by people pleasing, avoidance of conflict, sometimes even overachieving. So there's like this, we look at any of you know Dr. Gabor Mate's work. He really characterizes and has kind of created this personality type of like who gets sick, why do we get sick, and who gets sick. And so often it is the folks who are fawners, who are maybe were parentified children at a young age, and that continued on. And it's amazing. I always say it's amazing that these adaptive behaviors happen because they helped us survive. They helped us get to this point. But now we're realizing that they're not helping us thrive. So, it's time to shift out of that. And so we're going to talk about how do we get out of fight or flight. And before we go to the next slide, I want to use this as an example of when we're in a chronic stress response, when we're in chronic fight or flight, basically our brain is perceiving there is danger behind us. Like think of a tiger chasing us constantly. So I always say like, or ask this question of, will your body prioritize running away, getting away from the tiger, or is it going to prioritize you healing and getting you into this equilibrium of a calm nervous system? The answer is it's always going to choose survival over healing. So healing goes on the back burner as long as you're stuck in this chronic stress response. So I have seen amazing things happen when folks get into a more regulated state, a more flexible state. Healing really starts to happen, shifts and changes really start to happen. Okay. So let's talk about medical trauma, right? Hopefully someday we're going to see this actually written in the DSM as a diagnosis, because it is very real. And those of us who are healing from chronic illness understand it. And it can be from, being passed around like a hot potato, doctor to doctor to doctor, getting misdiagnosed, not being believed by your doctor, being gaslit by your doctor, having to do so many, so many different things in order to find the diagnoses. And anyway, so signs and symptoms of trauma related to this can be emotional, it can be flashbacks, intrusive memories, avoidance behaviors, hyperarousal, obviously physical symptoms, changes in mood and behavior, impact in daily functioning. Like I'm finding this medical trauma is complex PTSD. It's no different. It's no different than someone who experienced trauma at war. Like that's how it's presenting in people's bodies. So I just want to say this is very real, and it needs to be spoken about more. So let's talk about the role of stress and how it relates to chronic illness. So again, that tiger's behind us, and our bodies are just running and running and running, whether we are cognizant of it or not. So that's healing's on the back burner. All of our energy is going towards running away from this tiger. So what we start to see is hormonal imbalances, immune suppression. This affects the immune system. This affects the autonomic nervous system, which is in charge of so many things, including and not limited to our blood pressure. We see inflammation because we are overproducing cortisol. We're overproducing way too much cortisol. And again, a little bits here and there, totally quote unquote normal. But if we're constantly producing it at that rate, we are going to see physical symptoms begin to manifest. So there's also, mood disorders can come up, cognitive impairment can come up because it really starts to affect the brain. Chronic stress actually can shrink the brain. Sleep disturbances, unhealthy coping behaviors, poor self-care, and then back to this imbalance between the sympathetic and parasympathetic nervous systems. So, people, I don't know, for those who don't know the difference, right? Parasympathetic is rest and digest and rest and repair. That is our goal, to be in that state as much and as often as possible, versus being in a chronic sympathetic state, which is fight or flight, freeze and fawn. So let's talk about what mind-body tools are available out there. Present moment awareness, which is mindfulness, meditation, guided imagery and visualizations. I cannot recommend visualizing enough. And we may talk about neural retraining a little bit. Neural retraining is my favorite tool to get folks out of fight or flight. And it's very much based on visualizing. And visualizing is amazing because it releases serotonin and dopamine and floods out the cortisol. So we think of visualization sometimes as being woo-woo, and it's so not. It's really based on neuroplasticity, on changing the brain. And when we heal the brain, we heal the body. These two things are so not disconnected. And it's funny to me when, people or doctors will say, oh, it's all in your head. And I'm like, well, funny enough, it does kind of start in our brains, which is in our head. And not to mention, our head is not separate from our body. Like, when did we decide? Who decided this? Who made this up? But visualizing is incredible. We'll talk about it more later. Various calming techniques, whatever that looks like, listening to healing hertz music or tapping, emotional freedom technique, deep breathing exercises, if that resonates with you. And that's the other thing I want to say, like, one of these things may resonate and work really well with one human body and not with another. And it's important to find what works for us. Movement in a way that feels good, that's gentle, that's calming. Journaling, expressive writing, also a great way to release that serotonin and that dopamine. Progressive muscle relaxation, biofeedback, heart rate variability training, self-compassion, and loving kindness practices. All of these tools. And there's even more out there, but again, these are just some examples. So what do these mind-body tools do for us? They reduce stress, they reduce cortisol. Again, they release the dopamine and serotonin needed to really flood out the cortisol. And I didn't mention on the other one, but also anything creative, anything artistic is such an incredible mind-body tool. It's great for pain management. It improves emotional well-being, enhanced immune function, better sleep, lifestyle changes, improved cognitive function, enhanced self-management, reduced medication use in some cases, social support and connection depending on the activity. So yeah, thank you so much. And yeah, this is all of my information. If you want to check out my website or my socials, or if you have any questions later on, but we're going to move on to some examples that Katie's going to show us.
I was on mute. Thank you so much, Christina. That was also helpful. I wanted to actually come back to one of the slides up here. So I just had a question and thought others might have the same question. When it comes to kind of choosing an approach for kind of which set of things are going to make sense for you. How do you recommend people approach that?
I think it's important to find what calls to you. If you're, oh, I've really, for example, I started watercoloring when I was couch bound. I was really sick and I could barely, I needed assistance to walk across the room. And so I was limited in how mobile I was, and watercoloring, for example, and journaling really stood out to me as things that resonated. And so, I tested it out versus the deep breathing exercises for me did not quite resonate. I noticed that I was too much in a sympathetic state actually to do like the Wim Hof breathing. And again, this is just as an example. So I always say when it comes to anything we choose, or any practitioner we work with, or anyone we choose to socialize with, that we check in with the nervous system. Am I feeling more calm from this? Like, is this regulating my nervous system, or is this actually dysregulating me a little bit more? So it's important to just to check in, to follow your joy, follow your excitement, and allow yourself the flexibility to test it out and see if it does work for you or not. And again, just because some tool or medication or treatment works for one person doesn't mean it has to work for you. There is no one size fits all approach, which kind of makes this more, complicated, right? If there was one, we'd all be taking it or trying it right now. But it's important to check in with yourself and trust yourself and what is and is not working.
Thank you. And you said check in with your nervous system. I mean, I think I have ideas of what that might mean for me, but do you, what are the common ways people might identify that their nervous system is not happy with a given thing?
Sure. So just feeling some discomfort in the body, maybe feeling like your heart rate is a little bit higher than usual, or maybe it just depends. You'll notice an exacerbation of symptoms, basically. Like I know for myself, I would feel a little bit, yes, someone said tense jaw, 100%. Yes. I would notice I'd sometimes get migraines, or I would get dizzier, or I'd get more fatigued, or my brain fog would increase. I wouldn't be able to focus as much. And basically, our body, and this is a book by Gabor Mate, I highly recommend it, when our body says no, because often that's what has happened over the years is we've stressed ourselves out for so many years. We've been in, toxic situations or traumatic situations, and our bodies will whisper before they scream at us. And often we just press the override button because we think we know better. Like, it's okay. It's okay. We can do this. We can say yes to this one other thing. We can take this one other thing on. And anyway, basically when we start to heal, we start to enter, like, to me, healing is entering back into the body again. We become disembodied because we're scared, we're nervous, and I had moments where I thought my body was trying to kill me, like truly, genuinely. And so I noticed I was very much disassociating and just outside of my body, pushing it away. So me healing has been me entering back into my body and communicating with it and trusting what it's saying to me and listening to it and honoring it. And I don't want to come from a high horse and say I've completely figured it out. I'm still fine-tuning this communication as we speak. But I notice for myself, and I notice this for clients I work with, that there will be an exacerbation of symptoms. And so generally, it'll be the opposite. If something resonates and feels really good for us, we'll feel more calm. We may actually have more energy. We may just feel excited and joyous in our bodies. So I don't know if that answers your question, but
yeah, that was a great answer. Before we move on, does anyone have any specific questions for Christina right now? And we're going to save some time at the end as well. Yeah, Lauren, go ahead.
This is less a question and kind of more a shout out. Christina, you did not mention your fabulous journal. Christina also has this amazing symptom tracking journal called the Begin Within Today journal. And it's something that I use with all my clients and that I have used personally. And what I love about it is that it gives you some basic biomarkers to keep track of. And I think so many of us dealing with chronic conditions don't recognize until we're in practice with it, the value of tracking symptoms. Even as simple as my tummy hurts today, my tummy doesn't hurt today, right? And it gives this tracking gives us data we can actually bring to medical professionals. It sometimes gives us more of an objective view of what we're going through. But more than anything, what I love about this journal, and with reference to what we're talking about today with imagery in particular, is that there's space for note taking. And I find that sometimes when I'm taking notes, I'm actually drawing pictures and sort of drawing a correlation between one thing and another. And everyone's mind works differently, but I just wanted to shout that out because I think we all have ways of understanding things differently. And some of us might be more visual, and in whatever way we're able to kind of brain dump our experiences, I find that tracking is such an important thing to engage in, particularly in the early stages or when we're dealing with difficulties and pushback from our clinicians. So I just wanted to shout that out because I think this journal is really highly underrated in our space. And I think it's one of the most valuable tools, and such a wonderful way to engage with Christina's work, even if you're not one of her clients. So I just wanted to let everyone know that they should check out the journal if not already.
Thank you, Lauren. That's great. Christina dropped a link in the chat. I'm also going to follow up with, after this, I'll send everyone who has joined an email with links to resources, and we'll definitely include that as well. At Pictal, we are big fans of kind of using the hand to create art and to express ourselves. So having the room in the journal to draw pictures like you're talking about, I think could be just very powerful. So thank you for bringing that up. So let's jump ahead to, I think most people on this call have some background with Pictal, but I'll just give like the super quick background. So basically we're coming at the problem of it being really difficult to tell your story in these short appointments. And it's more difficult when you have a complex health history. It's, your doctor is not able to take in everything you're saying and really put together a picture. So we're using data visualization best practices to turn this very difficult and inefficient and often unproductive conversation into something more like a visual presentation so that everyone can have the same picture in their mind. That's sort of the core principle. And so just as an example, this is the type of health history timeline that we create with people. And I'll just break down what's in here. So at the top, you're seeing symptoms. And so these are graphs. It's not symptom tracking. So this isn't like careful tracking every day or every week. This is really your memory of how your symptoms unfolded over time. So we're sort of a complementary tool to symptom trackers and more kind of seeing the bird's eye view or the big picture. Then we also include things like diagnoses, which are seen here in blue, other kind of medical information like tests and procedures and surgeries and ER visits are often here as well. Important to this conversation today will be life events, and so those are in yellow. And as a general principle, the larger something is, the more important it is, or the bigger deal it is. So in this picture, you see this person has been dealing with ongoing stress. So we often use the size to indicate stress level as well. So this person has ongoing stress, and she had this, big stressful event with the loss of a family member. So we'll have a few examples of how stress fits into people's health history. But then we also include treatments or medications that someone has tried. Could be even like something like a dietary change, or even any of the strategies that Christina just talked about could be here on the timeline. And we color code them according to whether the patient or whether you felt it helped or not. So just as a way to start to see what's working, what's not working. And so, altogether, the goal is to give a holistic view of where you've been and what you've tried, and then to also enable us to start to see patterns and trends that would be, really difficult to see otherwise. And so, environmental factors like moving to a moldy house or having this very stressful, traumatic time in life that correlates with the onset of heartburn. And so this type of pattern is something that we have just seen over and over in our work with folks. So these examples that I'm showing are real people, but we've taken away most of the details so that it's anonymous. But you see here, so this is a different person, but they had this very stressful phase, and some really stressful events happened during that phase from around 2015 to after 2017. And then you see midway through 2016, symptoms started to appear. And then in the following years, they just started adding up and adding up. And you also see right in line with that big bubble in the middle here, the onset of chronic infections. And so, and those just kind of continue and seem to worsen over time. And so it's fairly clear example of the role of stress and, how it has played out in this story. Christina, is there anything you see in this that you wanted to bring up?
Yeah, so what I love so much about Pictal, like I fell in love with this project immediately when again Tyler introduced us essentially. And I'm like, this is fantastic because there is a true correlation between something traumatic or stressful we experience and physical symptoms, and then vice versa, right? They play off each other. So you can see that it's evident that the stressful phase correlates with when symptoms begin to arise. And if any of us work on our timelines who are healing from chronic illness, I can guarantee you will see correlations between the two, because our body will literally be like, they're in chronic stress, and now our immune system is getting hit hard by it. Our autonomic nervous system is getting hit hard by it, and things are going to shift and change. Our bodies will begin to, to start yelling at us and then screaming at us. So also just, not just stressful or emotionally charged situations or phases, but also like being exposed to mold or having some kind of injury. These are also traumatic and stressful. And so, yeah, it all plays into each other.
Yeah, and I have a question for you. So I think one thing I'm interested in getting your feedback on is kind of what putting this together and seeing this, how might this impact the stress response? I know what I've heard from people, but I would like to hear it from your perspective. Like, why might this be helpful for someone to put something like this together?
So you're asking how these events would impact stress.
So how seeing, like, let's say I'm the person whose timeline this is, how seeing this might change my stress response or affect my stress response, I should say.
Definitely. Thank you, Lauren, for bringing up my journal. That's amazing. And it works on a micro level, and this works on a macro level. And regardless of whether it's micro or macro, being able to see correlations feels extremely empowering. You're getting your story out there in a way that feels safe and calm to you. And then to be able to go, wow, when this happened, this occurred, you are taking your power back, because chronic illness can be extremely disheartening and disempowering. So you're able to literally see these correlations in real time and feeling empowered on a biochemical level is again going to release dopamine and serotonin, because you're going to go, wow, this makes sense. And then you're going to be able to bring this to your practitioner, and hopefully, you know, they have a similar response to you, and like, yes, you're right. This had to do with this, and this would definitely set off that, or trigger this or trigger that. And if you're working with a mental health professional who's proficient in all of this, they will be able to start doing work with you, not just neural retraining and getting your nervous system in a place where you can start looking at trauma and moving it through. But yeah, really just starting the deep work with you. Yeah.
Yeah. So I heard almost like feeling empowered, but also like justified and, you know, believed in a way of like this is really happening. And also
Yes.
I've heard from folks that they have this feeling of self-compassion and like self-understanding. Like you said, like, this is why we are where we are. Yeah.
Exactly. And I love those responses as well, because so often, right, we don't look sick, right? People see us and like, oh, you don't look sick. We all heard that probably at some point, but they don't know what we're feeling like inside. And being able to see this timeline, it justifies, no, I have been sick. This is real. This is, you know, no one can gaslight me out of this, be it a friend, a family member, a loved one, a practitioner, or most importantly, ourselves. You know, trusting ourselves in our experiences is so very important and vital.
Great. Tyler said, seeing my life event triggers was hugely helpful in understanding the onset of my condition. So yeah, definitely. Okay, so I think I'm going to move a little more quickly and make sure we save lots of time for questions. But yeah, another example of this is similar to the prior one, you know, a very prominent adverse childhood experience, and you've got stress, so kind of mental health reaction right away, and then the physical health symptoms coming on over time. So I think this is some like a pattern that we see over and over. This example has a little more going on, but I thought this was interesting as well, because this person also had a, you know, traumatic event, and there was just like a clear kind of jump up in depression that was sustained over time, and then the physical health symptoms kind of layered in. And this is something I've noticed with a number of my clients. I worked with some veterans who had been in combat, and often the traumatic event will happen at some point in their history, and it might take years and sometimes decades for the symptoms to really catch up with people. And is that something you've seen as well, Christina, in your work?
Yeah, I've seen both. I've seen it acutely affect folks and also affect them just over time, depending on what else they're moving through and how they moved through this event, right? You know, are they choosing not to feel it because it feels unsafe to? And if so, how long have they been putting it off for? And you know, the only way out of any of this is through, and we must feel it to heal it. So it's contingent on the person and where they are in on their own journey of the mind body.
That's so interesting. Thank you. So, you know, as we're talking about these stress reactions or chronic stress response, as you put it, over time, you know, start to build up and have these physical manifestations. And so one thing we do with Pictal as well is create these kind of symptom maps, is what we call them, so that you can kind of see everything that's going on and be able to communicate that more effectively with your doctors. And I put this one together just as like a template for people to pick up and use. And you know, it just has a number of symptoms that I have seen across, you know, working with 80 or 90 different people now, things that are very common. And so, and many clients also do have stress or trauma in their history. So do you see, I'm just curious, do you see patterns like this that just repeat over and over that seem to kind of go with almost like a syndrome of physical symptoms that result from stress?
Yes, first of all, is this mine?
Well, that's what everyone says when when I share it, they're like, is this me? Because this has all of my things on it. Yeah.
One of my symptoms. I mean,
Yeah.
I've a few others, but yes, definitely. I see repeated symptoms and how they're related to mental health and emotional health. And you know, so much of this is the autonomic nervous system, and a dysfunction in the autonomic nervous system, a dysfunction in the immune system. So yeah, the symptoms are going to be quite similar. They're going to vary person to person, but I'm very much one to notice patterns. And yeah, I see this pretty frequently, definitely.
Yeah. And there's, I think there's also kind of common conditions that people show up with, mast cell activation, autoimmune stuff. So, that's probably part of it as well. But yeah, it's just something I've noticed. The repeating patterns has been really interesting. I just love these two examples. So these were, I think one thing we're always trying to do is help make the invisible visible and help people be heard, seen, and believed, like you mentioned in the beginning. And so being able to kind of just make your pain real or make your symptoms real when so often people are disregarded, I hope is another kind of tool, can be a tool in people's toolkit. I will send out afterward. So this here is a Google Slides template where you could just pick this up. It's free. You can use it to make your own version of this. So we'll be sure to send this around afterward. Yeah, so I guess in addition to the examples I showed you are mostly ones that I had put together by hand years ago. And now we have an app that I just wanted to share very briefly. So this is the kind of Pictal web application where you can put together, assemble your health history in a digital way, and you can add to it and export it as a PDF to share that with your clinicians. So this is something we're very excited to be able to offer folks. And I won't go too far into that now because I want to save, I'm gonna stop sharing. I want to save time for questions now. So yeah, anyone have like thoughts or questions, feel free to put your hand up or drop in the chat. I would love to hear from you. I
have a question.
Yeah, please.
So this one, I might ramble because I feel like I don't know how to completely ask it, but I have seen, I'm sure others have too, in some chronic illness communities, people very much against, it's not mental health related, because they don't feel validated by their medical providers who say it's all in your head. And I feel like I've done extensive mental health modalities, and this is why I'm going into this program myself. How, Christina, you bridged that physical versus mental health care. And I feel like in the chronic illness community, it's very gray, even though it can be very black or white, because it's often a lot of people get stuck in one, realm of care. And I think I find myself, even like when I have strange symptoms pop up that I know are not necessarily tied to being stressed or what have you, and how you walk that line with your clientele, because I think it's a tightrope in a sense of, yes, many things can be exacerbated by stress or trauma, but also that fine line of physical, mental. I know it's all connected, but does that make sense?
Yeah, it makes complete sense. And this is why it's a requirement that anyone who works with me completes a neural retraining program, and that we validate what they're experiencing first and foremost, and that we are with that area of their body on an emotional level, on a psychological level. And also that they're working with a practitioner. It's my other requirement, is that you're working with a practitioner who you love, who you trust, who believes you, and that, they're helping on the biophysical level, right? So it's both things at once. My goal is how are you responding to this emotionally, like this physical thing coming up? I'm not here to tell you it is not real, because it's very real. You're experiencing it. So does that make sense? It's ensuring that, and I'm in contact with like most of my clients' doctors, so that we're talking it through. And again, if their diagnosis is very real, their symptoms are very real, but how is that impacting you on an emotional level? Like that's what I'm here to work with you on.
Yeah, the gaslighting thing is so prominent. And so were you also saying, Britta, that like you want to make sure that you're believed? You want to be able to say, yes, my stress and trauma is impacting what is going on with me, but what is going on with me is real and it's not all in my head, right?
Yeah, I think it's, personal. And then I think about other people I know online or in person that have chronic illness, and my future clients. And just I think it's almost like a juxtaposition of like, it is from people being gaslit, but it's also, there's some communities I follow via Instagram, and they're like, we don't need CBT for our intractable pain. And I understand, there's many modalities, and just trying to gently meld these things together, I guess, but also seeing how I personally struggle with like, oh, I have this new symptom, and maybe it's like internalized ableism or something, or self-gaslighting, but just I understand how things get worse with stress, and like the both and of like, and when is it not related to stress? I don't know. Sorry, it's just like not trying to turn this into my own therapy session. Something I've literally like battled in my own brain and with my own therapists and medical providers before too, because it is so complicated.
Yeah, it is. It is. And again, someone comes to you in therapy, like the goal is for them to feel safe and validated in your presence. And I would never tell someone it is in your head. What you are experiencing is real and is with you. I'm more concerned, like I said, about how that is impacting your emotional and mental health. And if that then is impacting your physical health. So we're just looking at things holistically. We're letting the client feel and experience whatever they're feeling without judgment, of just letting it be, because you and I are both healing from chronic illness ourselves. We know what that looks like and feels like to not be validated and to not be taken seriously, and to have that internal ableism of like, and distrust. Maybe this is just in my head. Maybe, you know what I mean? Like it's something we're working on simultaneously with them, which is why they're coming to us, because we get it. We understand how complex of an issue and how multi-layered this is. So honestly, just them, when you're working with them in the future, them just being in the presence of someone who gets it is going to be so beautiful and so healing to them on various levels.
Can I add one thing? I think too, Katie, with like the timeline, it is very validating for providers to see like the stressful event. And it's been interesting. I've had some providers who have no idea about like the body keeps the score type of like that stress can cause or trauma can cause autoimmune issues. So it's very interesting.
Yeah.
Overlap.
I've been doing some research on this, and so trauma actually can cause, I think, 6 of the top 10 most expensive conditions, that including autoimmune, even things like cancer, diabetes. So it is an important thing that I hope we'll talk more about. True also mentioned, True, do you want to briefly talk about this study you found? I think that looks really cool.
Yeah, I literally just saw this overnight. I think it was probably 3 in the morning when I couldn't sleep. When that happens and I'm just tossing and turning, I'll pick up my phone and play a little bit until it makes me tired again and fall back to sleep. And I saw this study reference that caught my eye, and it talks about, because so many times we're directed to things like cognitive behavioral therapy and told that that'll make us all better, and it doesn't. And this study resonated for me with what Christina was just talking about, because it references the importance of addressing the emotional component of what's going on. And I've been working with a therapist for the past year, and she's done some of this work. I'm interested to learn more about it to see if it's specifically what she's been doing or not. But and we don't do it every session, but she's touched on it in the way that they described it in here. But it just really resonated for me, Christina, with what you were just speaking about. So there's clearly something here that's showing up now in validated studies.
Thank you so much for sharing that. Anecdotally and personally, I have not found CBT to be effective for chronic illness. And the reason being is it's very much mental, and my goal when working with anyone is to get you back into the body. So if you're going to find a therapist, anyone here, if you're looking for one, find someone who's both traumatic and somatically informed. That is, it's vital. It's vital. And some of the modalities I'm finding to be extraordinarily useful. Constructed awareness is one of them. EMDR as well, with the aside that you need to have your nervous system in a regulated space before going there. And that's the other thing. When working with a therapist, make sure they understand that your nervous system needs to be regulated before you open up Pandora's box, because, and this has happened to me personally, when I started EMDR and I was really sick, I was couch bound, but I knew about the mind-body connection and I just wanted to jump into it. What could help me as quickly as possible? I knew I had trauma in the past. What could get this out of my system as effectively and quickly as possible? And I crashed for weeks after doing one EMDR session because I was not resourced. I was so dysregulated. I opened up Pandora's box and my body was just like, whoa, 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 this is way too much. This is way too much. Versus CBT in the past, which previous therapists, that's all they would do with me, was not doing anything. It was just, I was so if we're over intellectualizing, so if we're overthinking, we're under feeling. We must feel it to heal it. That's it. That is the only way through, feeling it to heal it. And I was just overthinking and overanalyzing and over intellectualizing, aka was not in my body. I was not in my body. So the moment I started doing that work in a way that felt nourishing to me, that was gentle enough for me to, that was safe enough for me to, I really started noticing a difference. And again, that neural retraining component, so very important. I had to get that tiger away from me, out of the room. It was, that tiger is placed there for various reasons in our lives, maybe one time, maybe multiple times. And it's there for a reason. Our limbic system turns on. That's that reptilian brain that says, run, escape, survive. It's meant to be there. I'm so grateful for it. It's not meant though to stay on all of the time. That's not its function. So my nervous system going to a flexible state, which took a long time, right? This didn't happen overnight. I'm not expecting for it to go to a flexible state overnight either. But as it moved towards that, I noticed a difference in myself, and I get to witness this anecdotally in all of my clients as well. So, yep, someone mentioned CBT not helping them. See, yeah, people come to me and they're like, CBT hasn't worked for me. And I'm like, well, guess what? We're not doing CBT. So don't worry. Accelerated resolution therapy has worked, similar to EMDR. That's awesome. Yes. So great.
Have you heard this stat? I'm going to get it wrong, but there's something like twice as many or 4 times as many nerve signals that go from the body to the brain as go from the brain to the body. I was just heard some stat like this. And so that's part of the reason why just thinking in your head is not really going to be able to impact your body. You kind of need to start with the body. I wish I came with that stat.
Yes. Oh, go ahead.
Oh, I was just gonna say, True wanted to know if you could say a little more about neural retraining in our last couple of minutes.
Sure. So think of neural retraining as an exercise for your nervous system. You're using a lot of visualization and it's based off neuroplasticity. That's what I should say, right? So the idea that again, we can heal our brain, we can heal our bodies. So it's a way of talking to ourselves, talking to our limbic system to let it know it is safe right now. It may have not been safe in the past. It is safe right now. And this requires consistency. This is no different than like physical therapy. If you break something and you need to heal from it, it requires this daily exercise. So there's a mixture of mindfulness and relaxation techniques. And then there's actual communication that's happening between you and yourself, your limbic system, your brain. And eventually you start to see a shift. You notice yourself being a little bit calmer, more so responding over reacting. And you notice your physical body shifting as well. Like I was down to 20 ingredients I could safely eat without an EpiPen. I had extreme chemical sensitivity, sun sensitivity. I mean, I couldn't leave the house. I was becoming agoraphobic because of everything was dangerous outside of my home and making me really, really sick. And neural retraining kind of gave me my life back. You know, this whole thing is a snowball effect, because what happens is that tiger's behind you and your brain becomes extremely perceptive and it starts to find everything that could be dangerous, even though it wasn't dangerous to you before. And so it is a snowball effect. It will continue to collect and collect and collect. Neural retraining lets that ball come back up the hill, gives you back those things, gives you back your life, gets you into a more regulated state. And as you become more regulated, now we get to do the work in finding out when and why the body started saying no, which is why Pictal's so amazing, because you literally get to see that. You get to see that timeline. And I think someone mentioned they showed Pictal to the therapist, and it's like, of course, like, thank you for, it's like, you're doing the work for your therapist. Like, we don't have to really dig in. We have it here. And when you're ready, when your nervous system is ready, we can really start to work with these things that have happened.
Yeah, thank you. And we're coming right up on the hour. Christina, you do coaching with folks, right? Chronic illness coaching. Would you say just a little bit about that before we jump off?
Sure. I am a psychotherapist and a coach as well. And I get to utilize so many of these wonderful tools to get anyone I work with back into their body, feeling safe in their body, maybe sometimes for the first time in their lives. And again, this doesn't happen overnight. It can be a longer process, but it can happen. It does happen. I witness so many beautiful examples of radical remission every day in my work. You know, like I had a client who went from being couch bound to recently walking the Camino, and never thought that would have been possible for her. So I'm just that I can't promise that for everyone. I'm just giving an example of what I do get to witness. I always say I have the best job in the world. But yeah, anyway, that's a little bit about, what I do.
Awesome. All right, so we'll be sharing with everyone a number of links. I'll share some of the resources that folks dropped into the chat, and contact information, of course, for Christina, discount code for Pictal for anyone who hasn't signed up yet. And yeah, just want to say thank you so much, Christina, for being with us here today. So appreciate all of your wisdom. It's just been an amazing session. So thank you.
Thank you for having me. Thanks to everyone who attended. Yeah, just wishing you all love and healing and self-compassion through this all. Yeah.
Awesome. All right. Thanks, everyone. Have a great day.
Take care.